Good afternoon and welcome to this afternoon's, this morning's, this evening's GPAC Improving Practice Working Group webinar on the impact of the COVID-19 pandemic on human security in Georgia, to be given by Zal Anjaparidze. GPAC is a member-led network of civil society organizations working on conflict prevention and peace building across the world. It is a really active network in 15 different regions of the world. And it works through civil society organizations that engage actively in peace building and to work on how to shift from reaction to prevention at the regional level. And well, here you can see on the global chart how the different regions are. There are regions in Northeast Asia, Southern Africa, the Middle East, Europe, the Americas. This lists all the regions for you. And it's very much member-led, grassroots-based, people-based in its approach, focusing particularly on human security. The Improving Practice Working Group is one of several working groups that cut across the regions, and our working group works to improve the way conflict prevention and peace building are done in practice, which means working to develop training manuals, to develop different tools, particularly on human security, conflict analysis, and multi-stakeholder approaches. And we also now are working increasingly online. We've had a couple of online trainings. For the last 2 years, we've been working on webinars, and this is something obviously that now other people are doing as well, but we have been pioneering at GPAC in how to reach as many people as effectively as possible in spite of distance and across the globe. Here, just to show you, this is a handbook on human security, an excellent training manual divided into different modules. So this is available free to download. And this, if you try this, you can get an idea not only about human security, but about how even to train and understand better about this very important approach to non-military security. Zal Anjaparidze will be giving you some talk about this. Here he is under the pink umbrella at the back. That's right, thank you for the cursor showing. So this was a meeting of our working group a couple of years ago in Vienna, where we actually had some extra training on human security. You can see how we are quite a diverse and happy group. So Zal Anjaparidze joined GPAC as a local coordinator of the Caucasus Dialogue Program in 2017 as staff of ICCN, the regional secretariat of GPAC. He is a member of the working group, and he used to work for various international projects on development, good governance, and the building of civil society. He was a project manager at the Czech NGO, People in Need, to the EU-funded program for promoting DCFTA in rural areas of Georgia. He worked as a senior program manager of a civil society program at the Europe Foundation and spent years working at various positions in the USAID projects in Georgia. Zal is also a journalist. He was editor-in-chief of the English language weekly Georgia Today, and he's also the author of numerous publications on the major events and trends in Georgia, published in both national and international media. We are very lucky to have Zal giving us this webinar today. He is one of the most active members of our group, and I will let him now take over from me. Please, Sal, go ahead.
Welcome to everyone. It's my pleasure and honor to be with you for the remaining 1 hour to deliver the webinar about the impact of coronavirus pandemic and human security. First of all, I would like to ask participants to present themselves shortly to just ease our communication. Please represent yourself and tell me from which country you are, please.
Hello, everyone. My name is Katerina Gabak. I'm a regional coordinator for South Caucasus, a regional coordinator for Central Asia and for Eastern Europe as well. I come from Ukraine, but I live in the Netherlands. As I'm coordinating South Caucasus is one of my regions, I'm already interested in this webinar. Thank you.
Thank you.
Hello, Sal and Katerina and everyone. I'm Lucy, who spoke to you just now, Lucy Nsebe, and I'm based in East Jerusalem. It's where I live, my home. I work mostly within Palestinian society, and I run an NGO here called Middle East Nonviolence and Democracy. I'm also a member of GPAC, chair of the Improving Practice Working Group, and also chair of the Nonviolent Peace Force, which is based in Geneva and works on unarmed civilian peacekeeping.
Hi, Zal. Hi, everyone. I'm Denise, and I'm supporting this webinar. And I think we only have one more participant left at the moment. I'm not sure if she wants to introduce herself, but we had more participants, but they just left. So yeah.
Okay, let's start, and I think during the webinar we will know each other better. First of all, why I have opted for this topic, because everyone knows that, what kinds of problem COVID-19 has brought to the world and to the humanity. And I think that sharing experience and information how a COVID-19 outbreak affected specific nations, specific communities, and how they have coped with this problem would have been interesting for our audience, because one of the things which we can do in order to address this huge problem is to share information, share experience, and tell each other what we have achieved, what we have not achieved, what are the lessons learned, and so far, and so forth. And so let me remind you that our webinar will be divided in two parts. The first part will be a narrative for myself, when I will share information about the impact of COVID-19 pandemic and human security in Georgia, and then the rest of the 10 or 12 minutes will be devoted to a Q&A session if any questions arise from our participants. And now I want to Could you help me to share my screen?
Yes, Sal, you have to, you will see underneath, you will see a share screen button.
Okay.
If you press that, yeah, it's
Yes,
starting
yes, yes.
now. Yes.
So, the COVID-19 outbreak has had a profound impact on people's lives in Georgia, and the experience shows that the scale and degree of the impact of the pandemic is different for different social groups, and therefore necessary to study these effects thoroughly in order to find the right approach in order to address and resolve these problems, which will contribute to efficiency and effectiveness of the response to the virus and will contribute to the mitigation of the negative impacts. I want to start my webinar with the address of the UN Secretary General Antonio Guterres. You can see his address and what captured my attention was that it's addressing to the domestic violence linked to the lockdowns imposed by the governments responding to the COVID-19 pandemic. I will show you how these lockdowns have affected the people, especially women, as a result of the lockdown, because we will look at the problem through the gender lens as well to highlight these gender-related problems which women encountered during the COVID-19 pandemic. The years of violence have left the healthcare system especially vulnerable in the developing states, and I can say with pride that despite that Georgia does not have a strong economy, but it has claimed success in coping with coronavirus pandemic because our country is internationally recognized as the country with the lowest death toll and one of the lowest number of those infected with the virus. Nevertheless, the unpreparedness of healthcare systems on the ground often makes the situation more precarious and affects the human security issues. I'd like to say a couple of words about the organization who implemented the assessment whose findings I would like to present you. This is a cultural humanitarian fund, Sohumi, which was established by the internally displaced person from Abkhazia, and this organization has recently joined the South Caucasus network of women mediators led by ICCN and established within the GPAC program. And the assessment was made in 11 municipalities of Georgia through online surveys and online meetings because the activity took place in April, May, where the pandemic was on the peak and it was impossible to organize face-to-face interviews. The survey involved 320 persons, which is not a big sample, but I think it gives a general picture of the state of human security during the pandemic. It was a rapid assessment. It was undertaken in order to rapidly address the problems detected after this survey. So what are the key findings? According to the survey, the people with chronic diseases, single mothers, lonely elderly, and large families are among the most vulnerable groups who have been most affected in the state emergency in COVID-19. Most of those surveys said that their human security situation has been deteriorated. But what I would like to say is that this COVID-19 has affected all three components of human security. As we know, these three basic pillars: freedom for fire, freedom for want, and freedom to live in dignity. And to divide the number of those surveyed in three groups, we can say that there are three major groups among the one group that says that although their lives have changed, the situation has not worsened significantly. The other group said that conditions have worsened dramatically, which created threats to their livelihood. And the third group, the least number of those surveyed, stated that the situation has not changed significantly, which can be interpreted in two ways. Either the population is dealing with the situation with more or less success, or the already difficult situation remains unchanged for them. What about the gender lens, which we will discuss later? There was the survey detected very clear gender inequality caused by COVID-19 crisis, reflected in the unequal distribution in housework and women's workload. So what about the unequal distribution of household responsibilities? The study revealed that largest percentage of those surveyed, about 37%, believes that women's workload has significantly increased as they have to work online from home and do housework at the same time. 31% noted that they have to devote more time to housework, taking care of family members, the sick children, and the elderly members of the family. And only 13% stress that the family members share the responsibilities of housework equally. And 90% indicated that the situation of women has not changed much since they always took more responsibility for the housework. And what I would like to underline here is that when they were asked what is the main problem in your life caused by the COVID-19 outbreak, most of them, about 95%, said that it was a stress and psychological problems. Therefore, the pandemic has caused a great stress and insecurity to the population who lost the jobs and incomes. And it's directly concerns the economic security of the population. The restrictions imposed by the crisis have had a painful and severe impact on citizens' economic security. A considerable number of people have lost their jobs as a result, and their families have lost the only source of income and livelihood. What I would like to emphasize the specific situation for Georgia, because many people are engaged in so-called informal business, which is undeclared business, and the coronavirus situation especially painfully hit this group of the people who are involved in the private and family-run business, and for those involved in the family agricultural activities, street trade, working with individuals in homes like as babysitters, domestic workers, maintenance and repair workers. Because most of them have been left out of the compensation provided by the government because they could not submit official certificate evidence of their employment. And now the government is reconsidering its previous approach in order to make some corrections in this compensation system. Therefore, these people left in despair and hopelessness have a vague and uncertain prospect of returning to their previous jobs. And this is one of the biggest challenges which COVID-19 has brought to Georgia, especially its vulnerable population. They have lost their source of employment and income. That was the most frequent answer on the question how COVID-19 affected their economic security. Another issue which I would like to touch upon is impact of COVID-19 on the possibility to receive education. The spread of COVID-19 and the introduction of online education in public and private schools created many technical and emotional problems in the household, in the families. People who were not prepared for online education, in particular, 67, about 20% of this 302 respondents noted that they do not have the capability to fully ensure the involvement of their children in distance and online education. As you know, because of the offensive of the coronavirus, local schools and universities have switched to the online education. According to the surveyed population, local computers, smartphones, is a major obstacle to the full involvement of children and pupils in the learning process. The second main obstacle is that in the families with several children, one computer and smartphone were not enough for their simultaneous participation in the academic process. And other additional obstacles for involvement of children in the education process that have been listed include a weak internet signal at the living areas, high cost of internet services, insufficient space or number of rooms where the children could study separately from other family members, and low technical skills to handle the online communication. Why I am listing these obstacles in detail? Because in the last concluding part of my presentation, I will tell you how this organization has addressed these listed problems and how did they help these vulnerable people. So, as you know, Georgian government from the very beginning imposed quite strict restrictions in order to stop the dissemination of the coronavirus. And despite some criticism from the part of the population, these strict measures certainly played a positive role in achieving those impressive results. That is relatively small number of our citizens have been infected with coronavirus, and as I mentioned, the death toll was relatively low. And because of these unpopular restrictions, they led to the numerous fairs, especially in terms of food security, because loss of jobs by the population, stopping the economic activities, and the travel between the cities, the restrictions imposed on the transformation of food products, and some other restrictive measures led to the increased fear of access to food. And most of the respondents surveyed believe that the limited access to food and other household goods was the biggest threat related to the situation caused by the coronavirus. This issue was especially acute and it was especially emphasized by the rural population, where the delivery of foods and other necessary items at the beginning of the pandemic was not regular, and during the online information meetings, it was noted that a sharp decline in shortage of food and household goods in the grocery stores was observed in considerable number of villages. This problem was especially topical in the villages adjacent to the dividing line with the secessionist regions, where the population faces increased threats to their human security. And also people from villages, I mean the rural population, also talk about the timely cultivation of lands with tractors and treatment of plants with special chemicals, which left during the restriction, during the restrictions. And of course, people who were left without sources of income could not afford to buy special chemicals, which are quite expensive. And now I would like to bring your attention to the COVID-19 impact on the physical safety of women, which I think will be the most interesting part of webinar once we decided to look at this problem through the gender lens. The pandemic-related crisis and the numerous restrictions imposed by the state of emergency and the constant fear of being infected the deterioration of economic situation in families, increased responsibilities and obligations in the lives of women, and related stress and psychological problems, would definitely had a negative impact on the daily lives of women. Women experience constant psychological stress, and they have become the victims of domestic violence. One-third of the surveyed respondents claimed that the situation with the epidemic has increased the cases of domestic conflict and violence. I want to cite one of the women who participated in the survey, that the situation created huge problems for families and couples. Relations between them have become strained, although the present environment has led to reuniting families. The problem of relationships between couples, children, and other family members has been also raised because when before the pandemic, for example, spouses and couples were not sitting together at home for days. When the COVID-19 forced them to spend most of the time together, the families which are characterized with the domestic violence have become particularly vulnerable, because women have increasingly become the subjects of domestic violence, and the limited or no access to the internet and telephone, and the unawareness of women about available services of assistance and support, especially in villages, made women the victims of violence, and made and us and some women remained silent and refrained from addressing law enforcement bodies. One may be surprised by hearing this, but why women did not address law enforcement bodies when they were kind of subject of domestic violence? I think this comes to some cultural issues in Georgia. Often women are often women consider it's a shame to talk about their domestic problems and their relations in family, and believe and this issue is not a priority for the society and the police and the state in general. So they prefer to stay silent and not to report about this problem. But fortunately, for the last years, the increased education and specific programs on that have resulted in increasing the number of women reporting on the cases of domestic abuse and violence. And here I also want to touch another impact of COVID-19 is health security. Health security. The constant psychological stress caused by the pandemic had a serious negative impact on the health of the population, as evidenced by the response of the sizable number of the sample. The pandemic has significantly worsened my health, said one of the respondents. For example, unsanitary conditions of laboratories, especially buildings, became source and cause of some infectious diseases, and created serious psychological stress for the population. Living in unbearable conditions creates constant want for healthy and secure environment, and simultaneously breeds fear of health damage and even sudden death. And as you see, this is a list of the gender-related problems revealed during the survey. I talked about them, but as a reminder, so I want to show you, and maybe you will have some questions on them, because I know that many of you are sensitive to the gender issues. And as you know, the sizable number of IDPs are living in the areas which borders with the so-called demarcation line, which separates Georgia from these secessionist regions, where the violence is particularly high, different kinds of violence, and the threats to human security are incomparably high as compared to other Georgian regions. And the women living near the dividing lines feel desperate and left alone in the face of many challenges. And they say that they are left without due attention and support from the state authorities. And these are the challenges on the ground revealed by the survey. And when I compared the threat to human security caused by the COVID-19 in other regions, for example, in Libya, where the hostilities are underway, I found that also with the severity, the human security threats are incomparable with those in Georgia, but many threats are similar, and they have much in common. And now I would like to go to the recommendations elaborated by the Cultural Humanitarian Fund Sukhumi to the municipal authorities, because these recommendations and their advocacy helped much in order to sensitize the authorities and bolster them to provide assistance to the most needed, the people who are in the most need and who are most vulnerable, because the recommendations were based on the priority needs, and these priority needs included kind of medical checkups and consultations, paying internet service costs, the providing children and students with computers, smartphones, provision of face masks to defend from infection, and special gloves, and the consultations from the psychologist to manage stress and negative feelings and emotions. So here are the list of recommendations, and what I would like to say is that these recommendations have not been left on the paper. You see, unfortunately, many NGOs elaborate recommendations, but then do nothing to advocate for their implementation, which is the hardest task for civil society actors to have the recommendations accepted and implemented by those to whom they are addressed. So here you see some other recommendations, how the foundation, how Sukhumi Foundation deal with this problem. And one of the recommendations, please pay attention, is to reduce misinformation and stigma around COVID-19, because during the outbreak of COVID-19, we saw here in Georgia very big wave of misinformation, which was extremely harmful and even became a subject of very heated discussion in the society, and sometimes caused conflicts because some dishonest persons wanted to exaggerate the picture, to paint the picture in black in order to gain their own goals, and so the misinformation was one of the problems, as well as stigma caused by the COVID-19. And our ultimate goal is, what I would like to say, is that once we represent the organization which is engaged in conflict prevention and peace building, of course we look at the COVID-19 problem from this angle, and it's critical to ensure that achievements in conflict resolution and prevention, peace building, and increased participation of women in this process are irreversible, because only increased participation, inclusivity of the process can eliminate any controversy, any misunderstanding, and even conflicts which might arise during the anti-COVID-19 measures. And now I want to tell very briefly the human security problems resolved by the advocacy efforts. The first problem was supplying foodstuff to the 390 vulnerable and socially disadvantaged families in 11 municipalities, providing 62 women with psychological services by telephone and online, in individual and group sessions, persuading municipal authorities to ensure the transportation of the medical doctor twice a week to the villages adjacent to the dividing line, and carrying out ambulatory outpatient clinic examinations and medical consultations, and providing assistance to the villages adjacent to the dividing line in seeking alternatives to insurance of agricultural products harvest, informing the population on possible options, and negotiating with insurance companies about possible concessions. And the last but not least is providing unlimited internet packages for mobile phones for the most vulnerable families on the other side of the demarcation line, which helps them to ensure uninterrupted access of children to the educational process. Thank you. So if there are any questions, I will readily answer them. Are there any questions?
Well, I'd like to first of all say thank you very, very much, Sal. I found that fascinating. And I found really a great many similarities with the Palestinian situation, both in relation to women and in relation to, for instance, education and so many of the fears and the needs. I had a question. You said about the lack of change in the roles that I think only 30% of families, people shared more. But one of the things we have found here is that while, yes, there has been unfortunately an increase in domestic abuse, as there seems to have been
Yes, exactly.
globally, what we have also found is that there have been cases of men actually learning to share more, in that particularly because women are a lot of the health providers, so they have to go to work as nurses or whatever. So the men are actually forced to take on a new domestic role, and this is something not huge numbers, but it is one slightly positive side to things.
Yes, I agree, because for the last years, a number of educational programs have been implemented in Georgia thanks to the various international donors to increase awareness of men and make them more gender sensitive and though very slowly, but these programs are bringing their results.
This was not just programs including men. This is just the daily practicalities, because the women go to work in hospitals and the men someone has to take care of children.
Yes, but
the men are actually forced into the position. I don't think it's necessarily through education or through choice.
you see, in Georgia, this happens very seldom. It comes to the traditional and cultural issues. It's very hard to find men who will take care for children, because men are breadwinners. They also work. So if the family can afford babysitter, it's okay. But otherwise, women are forced to stay at home and do it homework. And sometimes many well-educated women cannot realize themselves professionally.
Yes, unfortunately, we get a lot of that too. We have also had an increase in incest and problems like that through people being locked down and shut in.
Yes.
Maybe there are some other questions.
Yes, I have a small question, and I also wanted to thank you for this broad and vivid picture of the consequences of COVID-19 and pandemic on human security, on the destiny of women, on their position in families. And I just wanted, well, my question is mostly philosophical, but maybe I think it will be useful to reflect on that. How do you think this pandemic and quarantine restriction has affected the society in general? Maybe there were some specific changes that you've already noticed. I mean, not only in security, but like human behavior in general. Because I think that as this pandemic is global, we all suffering from it, but like those lessons that we get from this situation is different, and maybe for like you previously discussed the position of women in families, maybe in some families men actually understood that if their wife works as a medical professional, then she actually does something important, and that then while this man stays at home, maybe he can participate in those housework tasks more, or maybe nothing changed in that terms, but maybe there were some other changes. Maybe you've noticed something.
You see, well, thank you for the question. It is a very interesting question, which I was given several times when I was giving interview to our media. The question sounds like this: how an ordinary Georgian has changed after this COVID-19. And my answer is that it's the ordinary Georgian has become more pragmatic, more centered on human issues, and I would say more sober, because observing the behavior of our citizens during the outbreak of COVID-19, it has reopened in our citizens the need and a sense of mutual assistance, mutual support, and the need for doing more charity, more volunteering. So I think the COVID-19 was a positive experience from some point of view, because it made people to think over the things which they have not thought before.
Yeah, thank you. Yeah, I also think that too, because as far as I know, Georgian people, they're really generous and like to communicate with other people. So I think giving a helping hand to each other, it was always the thing, but I think that pandemic probably increased its ability and understanding why it's important. Yeah.
Yes. Yes.
And also, can I ask another question?
Yes, please.
Yeah. You mentioned quite an exciting result about the advocacy efforts and human security, and how it's affected like specific amount of women or families struggling. And I was wondering if there are any information on the secessionist regions. Is there any possibility to work there, not only in peace building, but in general, maybe some humanitarian help or something like that? Because I was wondering if those people can actually go and get the medical treatment in Georgia, if they can get it there.
Thank you. A very good question. I can bring you even specific numbers. As many as 320 persons affected with coronavirus, or suspicious on having a COVID-19 infection, have been moved through this so-called border from Abkhazia to Georgia for receiving quality medical treatment. Another example is that despite this lockdown and curfew and closing the borders, the Abkhaz authorities did not prevent Georgian employees of Inguri power plant, which is situated on both Georgian and Abkhaz controlled territories, to enter the Abkhaz part of this hydropower station to do there some works, which is a demonstration of trust between the parties. So I think the change of the government in Abkhazia, which brought to the office people who are less adversarial to Georgians, opens some windows of opportunities to develop some cooperation in the depoliticized areas.
Thank you. That's I think that's actually amazing that Georgian medical profession could actually went there and like people could receive medical help, and I think it also will be a great start for the future. I mean, like just
Also,
a connection on this local level.
yes, the newly elected president of Abkhazia, Aslan Bzania, particularly noted that one of the areas of possible cooperation between Georgia and Abkhazia with the economic connectivity programs.
Thank you very much.
Are there any more questions? I'm really impressed by that last two also, Zal. And I would love to hear a bit more about the advocacy, but I don't know how we are for time.
I think we have about 5 minutes. I can talk about details of advocacy because these organizations, the Contra Humanitarian Fund, Sukhumi, has long established authority among the local municipal bodies. They trust these organizations, they consider them as professionals, and this means much during the waging of advocacy campaign. Secondly, they use for advocacy the methods based rather on a dialogue and cooperation than confrontation. And what's most important, they present the evidence-based information, because all the information, all the recommendations which they try to advocate for implementation is based on firm evidences which plays a significant role to persuade decision makers to be on your side.
Thank you. That's very helpful. Is there anyone else? Karen? There was someone called Eka, but she, I think, has left, and she said she had problems with her mic.
Yes. I can send you the presentation, and you can distribute it among the participants who want to see it.
That would be great, actually. I think it would be excellent. I think we should also send it to our working group. It was a really, really comprehensive and useful and clear summary, which I think has relevance globally. It's an excellent case study. Thank you very much, Sal. And thank you to all the participants. And with that, do you have any final words?
No.
Sentences? Or?
I want to thank everybody who has joined us and gave questions. Thank you for the participation.
Thank you very, very much.
And thank you for the patience.
Not at all. It was fascinating. Thank you so much.
Bye-bye.
Bye-bye. Thank you so much. It was really interesting and exciting to hear this case study. Thank you.
Yeah, it was great. Thank you very much. Bye.
Bye.